Hey doctors! Let's face it, dealing with death is never easy. But as doctors, it's a harsh reality of our profession. We swear to do no harm. But did you know even a seemingly simple death certificate can become a legal nightmare? Imagine this. It's 2 a.m., you're on call, and a patient passes away. You fill out the death certificate like you always do, but 3 months later, you receive a court notice. Your career is now at risk because of one small mistake you never knew you made. That's why today, I'm exposing the deadliest mistakes doctors make in death certificates. Mistakes that could end your career. Stay till the end, because the 7th point shocked even senior consultants. All right, let's dive right into these legal landmines, these seemingly small errors that can blow up in your face. First up, pre-signing certificates. I know, time is precious. But signing a blank death certificate is like signing a blank check. You have no idea what it could be used for. Next, certifying without examining the body. Look, I get it. Sometimes it's a clear-cut case, but trust me, this is non-negotiable. You have to examine the body personally before signing off. This protects you and ensures ethical practice. And for the love of all that is medically sound, do not use abbreviations on a death certificate. This isn't some cryptic note to your colleague. This is a legal document. I kid you not, a doctor lost their license for 6 months just because they wrote MI instead of myocardial infarction. Don't let your shortcut become a career short circuit. Okay, now that I've scared you sufficiently, let's talk about how to actually fill out this document the right way. Think of it like a recipe. Miss one ingredient and the whole thing falls apart. Step 1. Patient identification. This seems obvious, but you'd be surprised how many get this wrong under pressure. Double, triple check the name, age, gender, everything matches their medical records. Step 2 is crucial. Cause of death sequence. This is where understanding the difference between immediate cause, antecedent cause, and underlying cause is critical. Get this wrong, and you're not just messing up paperwork, you're potentially misrepresenting someone's entire medical history. Finally, time intervals. When did the patient die? When did you last see them alive? These timestamps can be crucial in legal situations, so be as precise as possible. Pro tip: take a screenshot of this part. You'll need it. Now, let's talk about some serious stuff. There are certain situations, my friends, where filling out a death certificate isn't your only concern. These are cases that require immediate police notification. No exceptions. First, suspicious deaths. Anything, and I mean anything that seems off, unusual, or doesn't sit right with you, call the police. Your gut feeling is often right. Second, unknown cause of death. If you can't definitively determine why the patient died, that's an automatic red flag. This isn't the time for guesswork. This requires investigation. Finally, no recent medical attention. If the deceased hasn't seen a doctor in a specific time frame, this varies by location, so check your local regulations. It raises questions. Don't get caught in that web. Involve the authorities. Chapter 4. Here's the thing about death certificates. It's not a one-size-fits-all situation. Your location matters. India, with its diverse states, has different rules, and ignorance is not a defense in the court of law. For instance, in Kerala, you're required to e-file the death certificate within 24 hours of death. Miss that deadline, and you're looking at potential penalties. Maharashtra has special forms for tribal areas, recognizing their unique customs and requirements. Using the wrong form is not just disrespectful, it's a legal blunder. And in Tamil Nadu, there's a bilingual requirement for death certificates. Yes, you need to ensure the information is in both Tamil and English. Chapter 5. The Digital Revolution, Navigating the Online Death Certificate System. Hold on to your stethoscopes, folks, because we're entering the digital age. The government is rolling out a new online system for death certificates, and it's mandatory from date. No more paper trails. Everything's going digital. Don't worry, it's not as intimidating as it sounds. First things first, you need to register on the official portal. The link is in the description below, so you can head over there after this video. Once registered, you'll need to upload all the necessary documents. Patient details, medical records, cause of death, the works. The portal is user-friendly, with clear instructions on what's needed. Finally, verify all the information you've entered, and I cannot stress this enough. Triple check everything before hitting that submit button. Remember, once it's submitted, changes can be a bureaucratic nightmare. Chapter 6. The 7 Essential Checks. Your career-saving checklist. Okay, before you sign that dotted line and potentially jeopardize your entire medical career, let's go through my 7 essential checks for every death certificate. This is the pre-flight checklist before you launch this document into the legal stratosphere. First, correct patient details. Name, age, gender, address. All of it must match their medical records. I know I sound like a broken record, but this is non-negotiable. Second, proper sequence of the cause of death. Remember our discussion on immediate, antecedent, and underlying causes? Make sure it flows logically and accurately. Third, no abbreviations. Write everything out in full using clear medical terminology. Avoid jargon or slang. This isn't the time to be casual. Fourth, time intervals. Be specific about the time of death, the last time you saw the patient alive, and any other relevant timestamps. Fifth, your registration number. This is your unique identifier as a medical professional, and it needs to be on that certificate. Sixth, clear handwriting. Look, I've seen doctor handwriting that could rival ancient hieroglyphs, but this isn't the time for creative calligraphy. Write legibly. And finally, the 7th and most crucial, check a digital backup copy. Yes, even in this digital age, keep a scanned copy of the completed certificate for your records. You never know when you might need it. Chapter 7. Don't risk it. Protect your career. Protect yourself. So there you have it, folks, the do's and don'ts of death certificates. It's a heavy topic, but as medical professionals, we're no strangers to life's fragility. But that doesn't mean we can't be prepared, right? Don't let a careless mistake on a death certificate derail your entire career. We've poured all our hard work, years of education, and sleepless nights into becoming the amazing doctors we are. And to make things easier, I've created a free downloadable checklist of the 7 essential checks we just discussed. You can grab it from the link in the description below. Print it out, stick it on your desk, and make it your new best friend when dealing with death certificates. And there you have it. Everything you need to know about death certificates and how to avoid career-ending mistakes. I know it's a lot to take in, but trust me, your future self will thank you for paying attention. Remember, being a doctor isn't just about treating patients. It's also about protecting ourselves. So stay safe, stay informed, and for goodness sake, triple-check those death certificates. And if you found this video helpful, do me a favor and hit that subscribe button and the bell icon so you don't miss out on future videos. Next week, we're diving into a topic that'll make your heart race: emergency medical legal cases that can jail doctors. Until then, take care of yourselves and your careers. Bye.